Well, I guess so. My name is Nnamdi Onochie, so I'm a researcher at Brigham Women's Department of Urology. What our project is on is utilizing a novel intraoperative navigation system to essentially make a map inside of the patient's body whilst a lymph node dissection is occurring. We do this using electromagnetic probes attached to different surgical devices, such as I think a Kittner probe, and then a laparoscope as well. And then we take CT scans done prior to surgery and during surgery. We mash the two together, and then we make a map, which you'll see shortly. So I'll press play. Oh, okay. Okay. Yeah. So now it's okay. So yeah. Um, Next slide. Is it how to go next slide? Oh, okay. Sorry. So yeah, I have no financial disclosures, nothing like that. So the purpose of, or the background, I should say, is it's pretty difficult for a lot of the physicians and surgeons we work with to assess potentially diseased lymph nodes in patients with potential cancer through physical exams and whatnot. Often the best approach to assess those lymph nodes is through um, uh, biopsies, which often lead to laparoscopic exploration. Since that's the preferred method, it has the lowest amount of risks. It has fastest recovery, but precise lymph node localization still is challenging. So advancements in intraoperative image guidance, such as those offered by the device or the device in question, in addition to the intraoperative scans done at the Amigo OR. Um, we hope to help alleviate that and make it easier for physicians and surgeons to localize lymph nodes of interest. Sorry about her. So our hypothesis is that it would essentially be easier to localize these lymph nodes with the navigation probes that we have developed, and then the software that we're using. Our primary objective in the study was to um, determine the feasibility in using this device and the navigation platform in 39 patients. Our secondary objective was to record laparoscopic video and to develop essential map of tissue deformation um, post or whilst the surgery is going on. So just a general overview of the procedure. So the navigation system interfaces with the probes that I was talking about that have been surgically that have been attached to the to Kittner dissectors and a laparoscope in a sterile field, so everything's sterile. Then all the tracking probes are registered to the navigation system to create anatomical model in conjunction with the preoperative and intraoperative CT images. The slicer navigation system then provides both visual and quantitative and auditory feedback to help surgeons locate avid lymph nodes accurately. That picture is just kind of a final representation of what I guess a surgeon would see whilst they're in operation. And then there's a video attached that will go into more detail about it. So press play. Is there volume or? Sure. He had a BMI of 39.63. In September 2021, he was diagnosed with invasive squamous cell carcinoma of the penis. Subsequent staging and evaluation with MRI of the pelvis at the time of the initial diagnosis demonstrated a 5 centimeter left inguinal lymph node. In November 2021, he had a total tenectomy and perineal ureterostomy. In December of 2021, he received adjuvant ifosfamide, paclitaxel, and cisplatin. In March of 2022, he had a PET CT scan which showed a 3 centimeter lymph node of interest that showed FDG uptake. This lymph node was the left inguinal lymph node. The plan for this patient is a bilateral inguinal lymph node dissection in the needle suite. Prior to the patient's procedure, the intraoperative navigation system is only used by the surgeon to localize the lymph node of interest. After localizing the lymph node, standard of care lymph node dissection will begin. The patient's diagnostic CT images are first obtained, then intraoperative C-arm CT imaging is also obtained, which is done for both intraoperative and diagnostic imaging can be fused. Once they're fused, they must be verified for anatomical features, which we will be searching for. Once verification has been completed, a patient-specific 3D model will be produced, which will be used by the surgeon to guide the imaging probe during the procedure. So yeah, this is just verification of the images, and then further on, we'll go into us actually fusing it. So here's what it looks like. The 3D patient-specific model generated, you can see the bladder, major blood vessels, and lymph nodes that are to be removed. During the lymph node dissection procedure, the surgeon will use the imaging probe seen here, along with the 3D patient-specific model, which will be seen shortly, to localize and locate the lymph node of interest. Here you can see the lymph nodes of interest in green, the probe in red. The surgeon will continue to do this to better gauge where the lymph node of interest is. Once gauged, you will hear a beeping sound, which will indicate the lymph node. So yeah, if you can raise the volume, there is a beeping sound once the surgeon brings the probe to the lymph node of interest. So once the lymph node has been localized, the standard of care lymph node dissection may proceed accordingly. Yeah. So, so far we've utilized the navigation system on 2 patients, and then we actually took it out of the Omega OR and brought it to general OR. So we were continually using it on more and more patients. We have not reached our goal of 39 patients thus far, but once we do, I'll be sure to submit a new or updated abstract of our results and our future directions. But yeah. So thank you.